Hello and welcome to NAFDAC and Your Health. Here we bring you up to date with NAFDAC's activities with regards to its mandate of safeguarding the health of the nation. I am your host. My name is Tosin Omolaja. Food packaging, whether at home or on the industrial level, plays a huge role in the total quality and safety of the food we consume. The materials we use, whether we are making benkei, popularly known as moi moi at home, or buying packaged food from a restaurant or supermarket, we must pay attention to the kind of materials used for packaging and cooking, especially at this delicate period when the world is still battling with the novel coronavirus with no end in sight. Taking utmost care of our health is of prime importance, and food packaging is definitely an issue to keep an eye on.
When it comes to use of plastics in packaging, whether it is in water packaging, beverage packaging, food packaging, the plastic should be bisphenol free, BPA free. And many packagings of plastics will have BPA free or the logo microwave suitable, so to say. Bisphenol is a chemical, again, that could mimic the things that are in our body, but will now pretend in a way that is that chemical in our body, but it will change the process to cause cancer. So bisphenol or BPA-free plastics are the ones that we're supposed to be using for packaging. Plastics have components that mimic estrogen, which is a natural hormone. And that chemical that mimics estrogen, when it gets to the body, will start acting like estrogen, but it's not the estrogen that comes naturally. And it can cause a lot of complications. Cancer is one of the side effects of using plastics that has all these chemicals that will leach into the food, especially when it is heated. It's not just using plastic to wrap mai and boil it. It's even using plastics. There are some plastics that have chemicals. When you heat them in the microwave, it will start leaching into the food. There are some plastics that can be used, but they will indicate it at the bottom of the plastic itself, whether it's a bowl or whatever container, that this can be used. They will use microwavable, they will use the logo for microwave, that yes, it can be used for microwave. But if it's not for microwaving, rather, if it is not indicated, it means that it's not supposed to be used in the microwave. This is what I do. I don't use plastic to heat food up in the microwave. I use ceramic or glass bowls or whatever. That doesn't mean you cannot use plastic to freeze. You can use plastic to freeze. You can even thaw the frozen food for a minute or two until you are able to break it up, and then transfer it into a glass bowl or a ceramic bowl. But generally, plastic should not be used in microwave or to wrap mai or whatever. The Ministry of Health and NAFDAC and some other agencies met, actually did some work, and we determined the level of BPA in some packaging materials here in NAFDAC. And we found the levels, some of the plastics, higher in BPA compared to others.
Beyond plastics, even the hygiene condition of the package production facility plays a significant part in the total quality of the food that will be placed in them.
You can imagine you are producing, what's it called now? Let me say pizza, okay? You are producing pizza in a restaurant. You have taken all the precautions, all the good hygiene practices. Your restaurant is perfect. Your food facility is perfect, excellent. Your workers are healthy. Okay? Your kitchen is clean. You disinfect it. In fact, microbial load, very, very negligible. Everything is glittering. You have all your wash hand, facilities, sanitizers, everything. You prepare your pizza. It goes into the oven. The oven will also kill all the bacteria that will be around it. And then you take it out of the oven. Then you carry it into a packaging material. Bam. This packaging material, you didn't produce it. You gave it to a printer. This printer, if you did not pre-qualify your printer, that means to go and meet the printer and say, look, this printer, I want to look at your printing press. Let me see. I want to see whether the cardboard you are making for me, I want to see how you are putting it through your machines. How clean are your machines? Your own workers, are they healthy? That is, the workers are the printers who are printing the cartons for you or the packaging material. It doesn't apply to only pizza. I'm talking of even pure water sachets or even bottled water or even all these bottled soap. If the printer that makes the packaging material does not also have a good hygiene practice in place in his own printing press, then all your efforts in your processing facility is in vain. Because after all the precautions, you are now putting this thing into a carton, into a packaging material that has a lot of contamination and bacteria, whether it is chemical or ink, maybe even printing ink from the factory, from the printer. Because if you consume printing ink, this is a contaminant. It's a chemical contaminant. You are not supposed to be eating it. You're not supposed to ingest it, So, but by the time you start ingesting traces and bits of this, you can expose yourself to a lot of danger, endanger your organs and all that. So, take all the necessary precautions, and with that, we will be able to produce food that is safe, hygienic and safe for human consumption.
Leaching is another problem that is of grave concern to NAFDAC. For instance, not all kinds of printing inks are good for printing on food packages because these chemicals have a way of migrating into the food itself, which may be hazardous to health in the long run.
When you talk about packaging materials and what you call leaching, but technically it is migration. Migration of the packaging material or or processing equipment or material into the food. Do you understand? And there are procedures to check that. Do you understand? There are tests, you call it migration tests, that you carry out to check whether there is any movement from the material into the food. So there are sensitive equipments that can be used to detect this, and that is done. And it's one of the requirements, that we also look at, when we are assessing products. NAFDAC is a scientific organization. Do you understand? So that is why we take all necessary precautions, and we try to ensure that whatever people use and package and say they want to sell to the public is, safe for them to consume. It's safe for everyone to consume, and we do thorough work on it, which includes laboratory checks. And then we also do a lot of literature review.
There are many packages that are meant for food. But we have discovered that migration of the materials used in the packaging into food are very harmful. When you add water to glass, that water as a solvent will dissolve very minute particles of the glass, which is not very significant to the body. But when you come to plastic, it is much. Especially when the food you are going to package is hot. Now, plastic packaging. The chemical used in making up the plastic is not permeable to water, and it is difficult for water to lynch it. But when the water is hot, the benzene ring in the plastic cannot come out. So we should be careful in packaging food with hot food with plastics. Though there are some plastics that, in as much as it will come out, but the quantity has been measured and it is not harmful. The amount released may not be harmful, but that doesn't mean that it doesn't release chemical into the body. We should look at these things so that we don't keep on adding chemicals that can cause cancer in our body. It's even better to go natural by going to the leaf. Yes, plantain leaf, the natural leaf that they are sold, wash it very well and use it to cook. It doesn't bring in any disease.
The hazards that these seemingly harmless actions and materials pose to human health are enormous, especially when we mishandle and misuse plastic materials by placing them in the conditions that make them dangerous.
We have found people using nylon to wrap amala at wedding, hot amala, hot, what do you call it, semovita, and even hot soup. This will cause the chemicals used in the production of that nylon to be leaching. Now, talk less when you add the something and heat it. You are consuming a lot, like like oba, the native. Is not proper to use this. Better, we can find there is this. No, it's not still not good aluminium, but it is safer than nylon. You come to aluminium, especially aluminium foil. People use it to wrap hot barbecues and heat it. This will cause the aluminium to migrate into the whatever you are eating, and you eat it direct, and it goes to the brain, and it causes this Alzheimer's disease. We should be careful on what we eat.
We'll take a short break now. Don't go away. Welcome back. You're watching NAFDAC and Your Health. The reuse of containers such as bottles, jerry cans and drums for food packaging and storage is an extremely dangerous practice that puts the health of food consumers at great risk. These practices are discouraged and must be stopped.
People who go to pick empty plastic bottles around, because it's a very serious concern. You go to the dump site and pick plastic bottles. There are plastic bottles that people with tuberculosis have used to drink water. Those kind of plastic bottles should be incinerated so that you don't, then you bring it and think if you wash it with ordinary soap, you think you've cleaned it enough, and then you sell it to somebody who is producing yogurt or producing sobo, and then you are really transmitting a lot of diseases. So we want to discourage reuse of those kind of plastics. It is better you send it for recycling and buy new plastics if you are going to, if you have to produce using PET bottles. Do you understand? We want to enlighten people, and that is what we need to do, to let people know the hazards associated with such practices. Some of them, 60, 70, 80% of them may not know the implications of these actions. They are thinking these are economic activities, scavenging bottles and giving people to reuse. But there are serious hazards associated with those things. Even the scavengers themselves are exposed to a lot of hazards, because they can pick up any form of illness or disease from there. Do you understand? Even the factory workers who want to wash, these factory workers that you claim you have tested to make sure they are healthy, and then you now tell them to go and wash bottles that were brought from the dump site. Of course, there is a lot of contamination. They could pick up illnesses from there that may not manifest immediately, and since you don't test them every month, you test like once in 6 months, that is when you do food handlers test to be sure that the people are healthy. So we completely discourage this practice where people will go back and pick recycled bottles or materials like that and reuse. We also have situations where those bottles could have been used to carry very dangerous chemicals like sniper or kerosene or diesel, or even poisons like cyanide, or even dye stuff, that you will never know because you don't have a history to how this bottle has moved. Do you understand? So we want to advise it is better. Most of these empty bottles are sent for recycling. They are crushed and recycled. There are quite a number of recycling facilities around that take these plastic materials and actually recycle them.
There's no amount of washing that you can remove the chemical, because a lot of leaching into the container, and it goes back to whatever food item. Is it oil? Is it water? So even when we meet importers or manufacturers, we always advise them, how do you dispose of your empty packaging when you finish using what is inside the container? Do you just sell it to anybody? You know, you cannot recycle it for use for products that should be consumed. It's not allowed at all. I'm using this opportunity to talk to Nigerians out there. Do not buy a used container of chemicals, even any container you're not sure of. If you want to store water, if you want to store oil, I will advise that you go and buy a new packaging material produced by all those people that make plastics. We have plastics jerry cans, and don't use the one that has been used to store chemicals. No matter how they assure you that they have cleaned it, it's not possible to clean out the chemicals, because some of them may have leached onto the containers, and it's not safe for health. It can lead to cancer and all other non-communicable diseases that there's really no cure for. So it's a very dangerous attitude.
NAFDAC, now more than ever before, has heightened its enlightenment campaigns, reaching out to stakeholders in the food sector who are most likely to use plastics as one of their food packaging, are armed with the right information and technical know-how in order to make the right decisions for its use. This initiative also extends to manufacturers of packaging materials, packaged food, and packaged water.
We take all necessary precautions, and we try to ensure that whatever people use and package and say they want to sell to the public is, safe for them to consume. It's safe for everyone to consume, and we do thorough work on it, which includes laboratory checks, and then we also do a lot of literature review to check to know whether certain combinations, where certain materials can be used or cannot be used. So there's a lot, and we're also members of several international organizations, like the Codex Alimentarius Commission, which is a WHO, FAO joint, organization, where a lot of things on food safety and food standards are actually discussed and agreed upon. Do you understand? And anything we do, we follow those standards. We also have the Nigerian industrial standards, which we base, most of our things on. We expect that people who are using, we expect that packaging materials that are being used by people, by most of these organizations, we expect that they have some level of certification and approval from the Standards Organization of Nigeria, so that we as NAFDAC, we don't have to bother too much about that. If we see that this has already been sorted out and the quality of the packaging material is attested to, then they are free to use it. Do you understand? So, but where we are not sure, we do check and make sure that due diligence is followed.
That's our package for today. But before we go, let's bring you a roundup of NAFDAC's activities around the country. That's on NAFDAC Update.
Federal government set to ban alcohol in sachet and others. The Director General of NAFDAC has made known plans by the federal government of Nigeria to ban alcohol in sachets, polythene, terephthalate, and glass bottles. Professor Mojisola Adeyeye, in a statement titled NAFDAC Cautions on Alcohol Use, asserts that uncontrolled access and availability of high concentration of alcohol in small sachet and small volume PET or glass bottles have been put forward as a factor contributing to substance abuse in Nigeria, with its negative impact on the society. Furthermore, she said the World Health Organization reports that alcohol consumption contributes to 3 million deaths each year globally, as well as to the disabilities and poor health of millions of people. NAFDAC, with full support of the Federal Ministry of Health, has continued to exercise its regulatory responsibility by ensuring that all alcohol beverages and other regulated products approved by the agency meets set standards of quality, safety, and wholesomeness. NAFDAC warns against Australian juice and banned Malaysian cosmetics. The National Agency for Food, Drug Administration and Control, NAFDAC, has advised the general public to refrain from consuming an organic apple and blackcurrant juice originating from Australia. The agency also warned against the use of banned Malaysian cosmetics products. Professor Adeyeye made clear that the said products have been certified harmful for human consumption. The DG made it known that the level of putolene content in the affected fruit juice can induce liver, spleen, and kidney damage, and that the toxic level would affect the immune system, thereby causing nausea, gastrointestinal disturbance, and vomiting. She also added that the banned cosmetics products, which include Sifu Kunyit Day Cream, Sifu Kunyit Night Cream, and JJ Skincare Glow White Night Cream, were all banned from distribution by the Malaysian Ministry of Health because they were found to contain hydroquinone, betamethasone valerate, and mercury, which could cause a change in the skin pigmentation, damage to the kidney, and increased risk to skin cancer. NAFDAC intensifies sensitization of bakeries. NAFDAC officers have intensified the sensitization of bakeries against use of potassium bromate in the production of bread. According to the Director General of the agency, Professor Adeyeye, the agency's surveillance activities and routine inspections discovered the lack of commitment by most bakers to good hygiene practices, especially in bread making. This has necessitated the agency's collaboration with relevant stakeholders through workshops and grassroots sensitization to ensure compliance in that regard. She explained that the illegal use of potassium bromate and other unapproved condiments in bread has been of concern to food safety. It is expected that all regulatory officers' interventions are employed to ensure that bakeries produce safe bread for consumption because bread is in high demand in Nigeria. She also urged bakery owners in the country at large to comply with good hygiene practices, principles, and other regulatory requirements. Safety measures to practice against COVID-19. The National Agency for Food and Drug Administration and Control, NAFDAC, implores Nigerians to strictly comply to the safety measures as outlined by the NCDC and the World Health Organization to ensure that the spread of the coronavirus is curtailed. Always wear a face mask when you are outdoors. Wash your hands with NAFDAC-approved alcohol-based hand sanitizers. Maintain social distancing. Avoid crowded places. Cover your mouth with your elbow when you sneeze or cough, or use a clean tissue paper and ensure that it is disposed properly and immediately. That's it on NAFDAC Update. You've been updated.
Here's where we draw the quoting on this edition of the program. Join us same time, same station next week for another informative package. In the meantime, if you have comments, complaints, or you want to report activities of fake drugs or adulterated food product peddlers, our doors are always open. You can reach NAFDAC via toll-free numbers. For inquiries, call 0700 162 3322. For complaints, please call 0800 162 3322 or email nafdac@nafdac.gov.ng. Importing, producing, distributing, and selling fake drugs and cosmetics, adulterated food, and so on are criminal activities that destroy lives. Join the fight against these heinous crimes by reporting any suspicious activity in your area to NAFDAC. Let's join hands to safeguard the health of our nation. See you next week. Stay safe.